I'm gonna knock, knock.
Hi.
Courtesy of privacy. I'm not gonna pull that. Hi, my name's Becky. I'm gonna be your nurse today.
Hi, Becky.
How's it going today?
Good.
Good. Can you tell me your full name and date of birth, please?
Yes, it's Olivia Murphy, and my date of birth is 6/2/1995.
Perfect. Okay, Olivia. So today we're going to be doing a head to toe
Okay.
exam. Can you tell me first where you are?
Yes, I'm at CSUSM.
Okay, and why are you here?
Just for my head to toe.
Okay, and then what day of the week is it?
It's Monday.
Okay, and are you in any pain today?
Nope, 0
No?
out of 10.
Okay, perfect. So patient is alert and warranted ×4. We assessed, so I went through your chart earlier, we assessed your height and weight and your vision with the Snell and eye chart. So it looks like you're about 5'6", 120 pounds, and your vision is 20/20. Sound about right?
Yeah.
Okay. And then we assessed your vital signs, and they're all within normal limits. We got 120/80. We got your pulses at 80. Your oxygenation's 100%, and your respirations are 18. So, do you have any questions before we begin?
No.
Okay, so patient, she's alert and oriented ×4. She's dressed appropriately for the weather. Her skin color is appropriate. For ethnicity, she's well groomed and well nourished. She's presenting with an appropriate posture. She's sitting erect. She's making appropriate eye contact, and her verbal responses are with a normal rate and tone. And so we're just going to jump right into it. Okay, so I'm gonna start at her head. So I'm just inspecting her head. I'm looking at her hair distribution. The hair color is appropriate for her age and her sex, and the color is as expected. So then I'm going to palpate. I'm palpating, the distribution is normal, there's no baldness, it's clean, it's not overly brittle, and there's no infestations of lice or anything like that. And then I'm palpating her skull, and I don't feel any lumps, and the skull bones feel symmetrical. Okay, so then I'm gonna come down to palpate her facial bones. Let me know if you have any tenderness with any of this. Okay, and then I'm gonna palpate her facial bones are symmetrical. I'm gonna palpate her frontal and maxillary sinuses. Any discomfort with that?
No.
Okay. Her skin is warm and dry. And then I'm gonna palpate her temporal mandibular joint. So go ahead and open your mouth. Okay, close it. All right, so there's no popping or clicking over the temporal mandibular joints. Okay, then I'm gonna go ahead, since I'm right here, palpate her lymph nodes. So we're gonna go pre-auricular, post-auricular, tonsillar, submaxillary, submental. Then we got our superficial cervical, deep cervical, posterior cervical, and the supraclavicular lymph nodes. Okay. From here, I'm going to inspect her ears. So I'm inspecting the alignment of her ears. They're symmetrical. The skin color is appropriate for ethnicity. I don't see any lesions, and I'm looking at the external auditory canal, and there's no drainage. And then I'm going to palpate her auricles, and I don't feel any lesions. Her skin is warm and dry. Okay, real quick, we're going to test cranial nerve 8, which is for your hearing. So go ahead and cover your left ear with your hand. I'm going to whisper 3 words and just repeat them back to me.
Red, white, blue.
Okay, cover your right ear.
1, 2, 3.
Perfect. Cranial nerve 8 is intact. So from here, I'm going to move down to her eyes. So I'm inspecting her eyes. I'm looking at her eyebrows, the hair distribution. It's as expected for age and for sex. Her eyelashes are distributed normally on the top and bottom. I'm looking at her eyelids. There's no ptosis. Her scleras are white. There's no jaundice or any edema. And then I'm going to go ahead and, so we assessed your cranial nerve 2 with a Snell eye chart. So now we're going to test your visual field. So go ahead and cover your left eye. So I'm gonna cover here. So I'm gonna come into your field of vision with my fingers, so just let me know when you can see them, okay?
Okay.
Okay.
See them? See them? See them? See them?
Okay, and then go ahead and cover your right eye.
I see them. I see them. See them. I see them.
Okay, cranial nerve 2 is intact. And then, so I'm gonna turn down the lights.
Okay.
I'm turning down the lights. I'm gonna assess cranial nerve 3. So I'm testing the pupillary reflex. So we have bilateral, it's equal, and then I'm going to have her just stare straight ahead. So we have direct and consensual pupillary response. I'm gonna go ahead and turn the lights back up. So cranial nerve 3 is intact, so then we're gonna continue to assess cranial nerve 3, 4, and 6. So go ahead and look at the end of my pen light. Okay, so I'm gonna test her pupils for accommodation. So they accommodate, they're equal bilateral. And then I'm gonna go through the 6 cardinal gazes of vision, testing cranial nerves 3, 4, and 6. Okay. And those are intact, so cranial nerves 3, 4, and 6 are intact. Okay. So now I'm gonna move down to her nose. So I'm inspecting her nose, it's symmetrical and midline. Palpating, no discomfort with that. Is there? No? Okay. And then I'm inspecting, I'm gonna have her lean her head back. I'm inspecting her nares, they're oval and symmetrical. And then the nasal mucosa is pink and moist. The septum is midline and the turbinates are equal symmetrical bilaterally. So then I'm gonna have her go ahead and cover one nostril, take a deep breath, okay? Cover the other one, take a deep breath. So her nares are patent. Okay, and then from here I'm going to inspect her lips. And so her lips are symmetrical vertically and horizontally. There are no lesions, the skin color is appropriate for ethnicity. I'm gonna have her go ahead and open her mouth. Okay, and so I'm inspecting her oral mucosa. So the oropharynx mucosa is pink and moist and intact. Her teeth are intact. Her buccal mucosa is pink and intact. Pink, moist, and intact, and then she has her teeth, and then her tongue is pink, moist, and intact. Okay, go ahead and stick your tongue out, and then say ah. So we're testing cranial nerve 9 and 10 with that. So the uvula, it rises midline, and symmetric, and then her tonsils are not inflamed or enlarged, and they're symmetrical. Okay, so from here we're going to test, I'm gonna have you do a couple of facial motions. We're testing cranial nerve 7. Okay, so can you raise your eyebrows, and then frown, and then smile, and then puff out your cheeks? Perfect. So cranial nerve 7 is intact. And the next thing we're gonna do is test cranial nerve 5. So I'm gonna take this and just kind of brush it against your face. So just let me know when you can feel it. Go ahead and close your eyes.
Feel it? Feel it? Feel it? Feel it?
Perfect. Cranial nerve 5 is intact. And then we're going to test your sensation. So I'm gonna touch your face. This is gonna be dull, okay? And this is gonna be sharp, okay? So just let me know. Close your eyes.
Dull. 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 Sharp. Sharp.
Okay. So cranial nerve 5 is intact. Okay, so from here, I'm gonna move down to her neck. So I'm assessing her neck structure. So her skin's appropriate for ethnicity. Her trachea is midline, thyroid's midline, and it is not enlarged. I don't see any signs of jugular vein distension. I'm going to go ahead and palpate the carotid arteries. Carotid arteries are 2+ bilaterally. And I'm going to auscultate those carotid arteries with the bell of my stethoscope. Go ahead. Take a deep breath and then hold your breath. Okay, take another deep breath and then hold your breath. So there are no bruits over the carotid arteries. Okay, so then we're gonna test your range of motion. So can you go ahead and curl your head forward and then back and then to the side and then go ahead and rotate. Okay, we're gonna do all those motions against my hand. Okay, go ahead and bend forward and back. range of motion and strength testing, 5 out of 5 in her neck. From here, we're going to move down to her chest and her lungs and her heart area. So I'm assessing the skin color. It's appropriate for ethnicity. Hair distribution is as expected. I don't see any unusual lesions. Did you notice any new moles or anything like that? Any changes? Okay, perfect. So I'm looking at her as she's breathing, her respirations, if she's using any accessory muscles, which she is not. And I'm noting the shape of her thoracic cavity. And the musculature, it's symmetric and there's no atrophy. So then I'm going to auscultate her lungs. I'm going to start on the anterior side. So every time I move the stethoscope, just go ahead and take a deep breath for me, okay? Go ahead and go under. Okay, I'm going to go around to the back side. So I'm assessing her back. I'm also looking at her thoracic shape and her scapula. I'm going to palpate her scapula. I don't feel her muscle distribution is normal and symmetric. There's no atrophy. Skin is warm and dry to the touch. I'm going to assess for thoracic expansion. So I'm going to place my thumbs at the 10th rib. Okay, Olivia, take a couple deep breaths in for me. Okay, and I'm observing my thumbs for thoracic expansion. Okay, and so here, I'm going to auscultate breath sounds the back. So just take a deep breath every time I move the stethoscope. Okay, so breath sounds, anterior and posterior, are equal and clear bilateral. She's breathing, her breath sounds are unlabored. She's not using any accessory muscles. And yeah, so from there we're going to move on to her heart. So I'm assessing her heart, her chest. I'm looking for any unusual pulsations. Her skin color is as expected for age and for ethnicity. And then I don't see any unusual pulsations. So then I'm going to, do you want to go ahead and lay back for me?
Yeah.
So I'm going to palpate the point of maximal impulse. Point of maximal impulse is the 5th intercostal space, mid-clavicular. And I don't feel any lifts, thrills, or heaves. Okay, and then I'm going to auscultate her heart sounds with the diaphragm. So we're going in the aortic, pulmonic, Erb's point, tricuspid, and then the mitral. And then I'm going to go through all of those same points with the bell. So we're going aortic, pulmonic, Erb's point, tricuspid, and then mitral. There's S1, S2 sounds heard throughout. There's no S2 or S3 or S4 murmurs detected. And if I wanted to hear certain heart sounds better, I would just have her turn on her left side, and then I could listen to those with the bell. Okay, so from here, we're going to move down to her abdomen. So I'm inspecting her abdomen, the contour. The skin is as appropriate for ethnicity. Hair distribution is as expected. I don't see any abnormal pulsations. Her contour is flat. and I don't see any unusual nevi or lesions. So then I'm going to auscultate her abdomen. So we're starting in right lower quadrant, right upper, left upper, and left lower. There's normal active bowel sounds in all 4 quadrants. Okay, I'm gonna palpate your abdomen just lightly. Let me know if you have any discomfort on doing that. Okay, any pain? Okay, perfect. So from here, I'm going to move on to assessing her upper extremities. So I'm looking at her skin, it's appropriate for ethnicity. I'm looking at the muscle distribution, it's symmetric, there's no atrophy. Hair distribution is as expected. There's no unusual lesions or nevi. I'm going to assess the skin color is warm and dry. I'm going to go ahead and look at her nails. So capillary refill is less than 3 seconds. Nails are pink and smooth. There's no presence of spoon nails or club nails. I'm going to go ahead and test her range of motion. Okay, so we're going to start at your fingers. So go ahead and splay your fingers. Okay, and then do it against my hands. Perfect. And then curl your wrists. Do it against my hands. Perfect. Go ahead and curl your biceps. Do it against my hands. Perfect. And then go ahead and bring your shoulders up. Okay, back down. We're going to do that. Thanks. Okay. And then we're going to test cranial nerve 11, which is spinal accessory nerve. So I'm going to push down your shoulders and then try to shrug them up. Okay, cranial nerve 11 is intact. And she has 5 out of 5 strength range of motion in the upper extremity. And then I'm going to assess her brachial pulse and then her radial pulse. So your brachial radial pulse is 2+ bilaterally. Okay, so then I'm going to have Lizzie sit up. When you sit up, I'm noting her ease of movement into the seated position. She moves with coordinated movement. Okay, so now we're going to move on to your lower extremity. So I'm assessing her lower extremity. The skin is appropriate for ethnicity. It is warm and dry. There's no unusual lesions or nevi. Hair distribution is as expected. I'm going to go and I'm going to test her capillary refill. It's less than 3 seconds. Her toenails are pink and smooth. And she has no edema. Okay, and then I'm going to assess her popliteal pulse, her posterior tibial, and her dorsal pedal pulse. So we have those pulses are 2+ bilaterally. Okay, and then we're going to do some range of motion in your lower extremity. So go ahead and extend your toes. So bring your toes up. Okay, do your toes against my fingers. Perfect. And then push your feet down. Do that against my fingers or my hand. And then extend your knees. Okay. Now do one against my hand. Perfect. And then go ahead and flex your hip. Okay. I'll do that against my hand. Perfect. Okay. So strength testing as 5 out of 5 bilaterally in the lower extremity. And I'm going to test her patellar reflex, her deep tendon reflex. Okay. So deep tendon reflex in the patellar tendon is 2+ bilaterally. Okay, so we're going to do a couple of sensory tests. So I'm going to have you close your eyes. So you remember that sharp and dull thing we did on your face? Okay, so I'm going to do that kind of all over your body, okay? So just go ahead and close your eyes. Let me know if it's sharp or dull.
Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Dull.
Okay. Fine motor sensation is intact. Okay. And then I'm gonna have you close your eyes again.
Okay.
And I'm gonna hand you an object and you're gonna tell me what it is, okay?
Is it a pen?
Yes. So her stereognosis is intact. From here, I'm going to go ahead and have you put your hands out, so we're testing your fine motor coordination.
Okay.
And you're going to take your finger and you're touch your nose, and you do about 10 times, but you're going to start to speed it up, and you're going to close your eyes while you do it. Okay? So go ahead and start. Perfect. Go ahead and stop. Okay, very good. So her fine motor coordination is intact. Okay, so from here I'm gonna have her stand up. So I'm going to move over here a little bit. So I'm assessing her back, palpating her spine. Or do you have any tenderness with that? Inspecting the musculature. Her skin color is expected for ethnicity. Skin is warm and dry. Hair distribution is as expected. Okay, then I'm gonna have her lean forward, and I'm assessing the curvature of her spine, if it's midline, and if there's any presence of scoliosis, which there is not. Okay, go ahead and stand back up. All right, so we're gonna move you through the rest of the range of motion for the back.
Okay.
So I'm gonna have you lean back, perfect, and then rotate to the left, and then go ahead and side bend, left and right. Perfect. Okay, and then while you're standing here, I'm gonna have you put your feet together, hands at your side, and just stare straight ahead for 30 seconds. Okay, then after 30 seconds, I'm gonna have her close her eyes. And then you can go ahead and open your eyes. So it's negative Romberg test. Her cerebellar and proprioception is intact. Okay, so then I'm gonna have you come over here, take 6 steps forward. And then on your way back, walk heel to toe. Okay, so her gait and her balance is intact. She walks with a normal balance. Go ahead and you can sit back down. And I believe that's all for our exam today. Do you have any questions?
No, thank you.
Okay, well thank you very much for your time.
Okay.
And I will see you soon.
All right, bye, Miss Becky. Thank you.